Dear friends, I am Dr. Rajeev Pachauri, an ENT surgeon from Agra, and I am practicing this part of the country since 18 years and dealing with all the ENT cases. Today I would like to discuss about the sinusitis, which is very common, very prevalent in this part of the country. The sinusitis is very broad term actually. We treat acute sinusitis, chronic rhinosinusitis, chronic sinusitis with or without polyposis. AFRS also means a fungal infection. But I think we treat acute sinusitis very well with the medical treatment. The most difficult part is to treat chronic rhinosinusitis cases with or without polyposis. And we all know that we treat CRS cases primarily with the medical treatment. If not, then we go for the surgery. But the post-op therapy is very much important in these cases. And after the surgery, which we are feeling, we have observed in a long time that it's very difficult to manage these cases because they don't turn on follow-up afterward. And follow-up is very important. We treat them with post-operative sprays, irrigation, antibiotics, lot of antibiotic, steroid also, and regular checkup. The role of post-operative antibiotic is very important, and we use since many years. I think we have started using these macrolides. Macrolides are very good anti-inflammatory and antibiotic property. And macrolides we use lots of. In the market we have erythromycin, clarithromycin, roxithromycin, and etc. But I think clarithromycin is still the best amongst all because of it has some additive properties. Clarithromycin has effect on gram-positive as well as gram-negative bacteria. It has good anti-inflammatory effect also. It has good immunomodulator effect also. It has a good, very good antiviral effect also besides the antibiotic property. It has very good immunomodulator effect because it inhibits the neutrophilic inflammation as well as it activates the macrophages by releasing different stimulants, and that's why it is one of the best immunomodulator nowadays. Antibiotic immunomodulator drug nowadays in the market, and we use in all the cases like post-operative rhinosinusitis cases, especially those who are inflammatory cases. We are using in almost every cases, and we give a dose of 500 mg, 250 mg to 500 mg once a day for at least for 1 month to 3 months. And in last 4 or 5 years, we have seen a dramatic change in the outcome of the patients. They are doing very well nowadays. Unlike in acute sinusitis or acute inflammation, we give broad spectrum antibiotic, other antibiotics, cephalosporin and aminoglycosides, etc. But in these chronic cases, this role of macrolide, especially clarithromycin, is very good. And we have observed if we see the biopsy report or histopathology report, pre-operative, post-operative, there is a dramatic change in the basement membrane thickening. Other advantage of clarithromycin is that it inhibits the biotin formation. It offers anti-inflammatory property, as I told you earlier. It decreases the mucus production and helps in the mucociliary transport, as well as it is 20 times greater concentration in the pulmonary epithelium tissue than in the serum. So it has multiple advantages, and that helps in the post-operative management of these cases. That we have already discussed that since we have started using clarithromycin as subtherapeutic dose, means 250 mg to 500 mg per day. Our results are ultimate dramatic, and we are very happy with this product since many years. The effect of the clarithromycin, we are not clinically, as well as if you go to biopsy report, if you see the endoscopic examination also, the changes in the mucosal appearance is very much better. As in, suppose in those cases we cannot use the macrolides, in those cases we are using macrolides, the difference is very obvious clinically, radiologically, histopathologically, as well as endoscopically. One more point I think I would like to share, that one more plus point with this macrolide, especially clarithromycin, is that we never seen any resistance to any bacteria with this drug. That is the biggest plus point, and we can use regularly afterward also, like after 1 year, 2 years, when we see that some infection is there. So overall, the post-operative results in our CRS cases have been improved a lot with the use of this macrolide, especially clarithromycin, and I am very happy with this product, this chemical content. Thank you very much.